Surgical audit. A surgical audit is a systematic and critical analysis of the quality of surgical care delivered by a healthcare team. It involves assessing outcomes and processes to identify areas for improvement. Surgical audits aim to enhance the quality of care, ensure patient safety, and optimize resource utilization. Key components of a surgical audit. 1. Planning and objectives. Define the purpose, such as evaluating outcomes, compliance with guidelines, or patient satisfaction. Set measurable objectives to monitor improvements. 2. Data collection. Collect data on clinical outcomes, e.g., morbidity, mortality, processes, e.g., adherence to surgical protocols, and resource use. Use standardized methods like electronic health records or manual chart reviews. 3. Analysis and benchmarking. Analyze the collected data to identify trends, patterns, or deviations. Compare results with local, national, or international benchmarks. 4. Implementation of changes. Develop strategies to address deficiencies identified in the audit. Implement evidence-based interventions. 5. Re-audit. Conduct a follow-up audit to evaluate the impact of implemented changes. Ensure continuous improvement by repeating the cycle. Types of surgical audits. Clinical audits. Focus on patient care and outcomes, e.g., infection rates, surgical complications. Process audits. Assess adherence to protocols and workflows. Resource audits. Evaluate efficiency and use of resources, such as operating theater time. Outcome audits. Analyze clinical outcomes, such as mortality and morbidity rates. Benefits of surgical audits. Improves patient safety and quality of care. Identifies gaps in practice and facilitates learning. Enhances team accountability and performance. Drives evidence-based practice and policymaking. Evidence-based surgery. Evidence-based surgery refers to the integration of the best available research evidence, clinical expertise, and patient values to make decisions about surgical care. It ensures that surgical practices are grounded in reliable evidence, leading to better outcomes and efficient resource utilization. Principles of evidence-based surgery. 1. Formulating a clinical question. Use the PICO framework, Population Intervention Comparison Outcome, to develop a focused question. 2. Searching for evidence. Conduct comprehensive literature searches using databases like PubMed, Cochrane Library, or Embase. Include randomized controlled trials, RCTs, meta-analyses, and high-quality observational studies. 3. Appraising the evidence. Critically evaluate studies for validity, reliability, and applicability. Use tools like GRADE or CASP to assess the quality of evidence. 4. Applying the evidence. Integrate evidence with clinical judgment and patient preferences to make decisions. Tailor interventions to individual patient needs and local contexts. Evaluating outcomes. Monitor the impact of evidence-based interventions on patient outcomes and refine practices as needed. Applications in surgery. Guideline development. Evidence-based guidelines help standardize care and reduce variability in surgical practices. Decision-making. Helps in selecting appropriate surgical techniques, choosing implants, or determining timing for surgery. Training and education. Encourages surgeons to stay updated with the latest research and innovations. Policymaking. Influences resource allocation and healthcare policies. Challenges in evidence-based surgery. Limited availability of high-quality evidence for some surgical procedures. Difficulty in applying generalized research findings to individual patients. Time constraints for clinicians to review and implement evidence. Resistance to change and adherence to outdated practices. Benefits of evidence-based surgery. Improves surgical outcomes and reduces complications. Promotes patient-centered care. Reduces unnecessary surgeries and resource wastage, enhances the credibility and transparency of surgical practices. Integration of surgical audit and evidence-based surgery. Surgical audits and evidence-based surgery are complementary processes. Surgical audits identify areas needing improvement, while evidence-based surgery provides the tools and knowledge to implement effective interventions. Together, they create a cycle of continuous quality improvement in surgical care.